Hey, Nifty Thrifty Dentists, Dr. Adam Vega here again, the host of the podcast. And we have a great guest here for you today. We're going to learn a lot. It's going to be a little emotional along the way, but man, she's doing some great things.
So before we get into this episode, I'd like to give a shout out to one of our sponsors, Addit. Addit is designed and engineered specifically for dental practices. It integrates with most of the practice management softwares on the market, and it is the only software solution that integrates voice over IP, text messaging, emails, patient forms, online scheduling, analytics, reviews, payments, and so much more. So reach out to the guys at Addit and ask for the Nifty Thrifty deal.
Hey, Nifty Thrifty Dentists, Dr. Adam Vega here again, the host of the podcast. We have a great guest here for you today. We're going to learn a lot. It's going to be a little emotional along the way, but man, she's doing some great things. So I want to introduce you to Parul. Parul, thank you very much for being here with us today. How are you this morning?
I am cold, but I'm well. Thanks for having me, Adam.
Awesome. Thank you. You're out in New York here, yeah?
Yeah, and the cold's starting to, come in waves.
It's come in. Colorado's just about that perfect time right in the fall here. So, Parul, we have you on today. Tell me a little bit about yourself. What are you up to? Tell me about your background.
Sure. So I consider myself a modern day nomad. I've lived in many countries, and now I call New York home. My parents live in Canada, so not too unfamiliar with the cold. And I'm a practicing dentist. I did a startup here after many years of private practice with a heavy Medicaid in Queens, and then I started my startup just before COVID in Long Island for a few years now. Um, and then to help me along the way to do my startup was my little kid brother who followed my footsteps into dentistry, and he had done a startup in 2016 and he was diagnosed with oral cancer in 2019 and passed away in 2021. But a lot of through the setups, he was there helping me, like, hey, don't do this, do that, get this, because I had little kids and he had already done this. So somewhere the roles reversed. Um, and yeah, so I lost him in the middle of COVID, and there came a lot of stuff with it. And now I focus on bringing awareness to oral cancer because, he was a dentist himself and he was under the care of oral surgeons. He was misdiagnosed, didn't get a biopsy in time. So, with oral cancer, you need an earlier biopsy to know what you're dealing with. So he was given medication without knowing what it is. And I feel that left to his cancer progressing more aggressively. And so now, yeah, I bring advocacy and change, hopefully, to the cancer world.
Awesome. Awesome. I mean, amazing background there, right? And obviously we feel for that story. But taking something from that, and you're talking about something where a lot of dentists are going through the same thing. They started up their business, they're getting something going, and wham, right? They get hit with something. Obviously not on the same level. I had my practice I started going, and I started having some health issues along the way as well. I mean, tell me a little bit about that when you're kind of in the midst of this, obviously professional, I guess, turmoil or growth or trying to go through there, and then being hit with something like that. How do you respond, and how did you kind of come out the other side to make something that's actually impacting from that?
Yeah, I mean, we both had it. Manu initially he was a solo practitioner. I'm going to talk about both, give him a voice, because he had a hemiglossectomy. Half his tongue was removed, and he had to have a graft from his left arm. And it was an 8-hour surgery, very extensive. And why I share is because there are people out there, dentists, who will go through or have gone through, not will, they may have to go through some life-altering negative impact life event. And he took only a month off and he was back seeing patients, but his speed wasn't there. He was only 33 at the time. So young, relative, no other issues medically. So, but getting back into practice was hard. And just with anybody going through any life event, maybe it's a broken foot, a wrist issue, back issue, anything, any surgery, he couldn't concentrate as much and numbness. So he had to slow down his practice, which can be hard when you have the only provider for the practice. And so bringing on an associate, trusting an associate who wouldn't take advantage of the situation, that you're undergoing medical treatment and you might not be physically able or mentally able to navigate some of that, day-to-day issues. So it's being very mindful of who you pick, and it's a good person that keeps your practice going and won't, you know, affect you negatively. For me, it was very impactful, not physically, but mentally. Um, when Manu went into, like literally Friday, he went into the hospital, couldn't breathe. The next day he was in hospice. I was seeing patients I couldn't drop. And this is, just to remind listeners that this was a time of COVID, um, when borders between US and Canada were shut and you couldn't just willy-nilly travel. You had to, something, I'd taken for granted, things that you take for granted and are no longer now a possibility, really affects how you navigate. And so I couldn't travel. PCR testing was taking 3 days at this point, and no rapid testing was allowed. So it was accepting the challenges that you have no control over. And as dentists, I think we're so controlling. We want to, control every little millimeter, watch the time. You are in so much control of what we do, our schedules, the treatment we process, how we do, what materials we use. We're in control of so many things in our profession. When life throws you like a loop, and then you don't have control, and letting go of those reins and say, okay, I'm going to have to make peace with it. And I have to still process my day. And a lot of self-reflection, community support, family support, and accepting, that tomorrow is not going to be the way you plan it. Life is not always going to be like what you had hoped for. Things happen. Um, but instead of resisting, but it's kind of like just going along with the waves and taking care of yourself along it. Um, I think self-care has just been the most important thing for me, because if it wasn't for that, if I don't stand up for myself, nobody else would, And I think as dentists, we're always doing so much for other people, for patients, for staff, keeping everybody happy, that we forget our happiness. And so for me, it was realizing that I got to step up for me.
There you go. Awesome. I mean, crazy times. I mean, thinking back through that, and then you're dealing with the personal aspect as well. Self-care. That's something that's probably still big in your life. What does that look like for you today?
So for me, I start a little late. My kids get to school. I have two young ones. And when everybody's gone, I have 2 hours to myself where I will work out, I will meditate, really ground myself and clear my thoughts, because our thoughts are so like, the mind can be a dangerous place. And, when you have so many things going on, you just need to um, focus. And I tell my child this, I'm like, it's like, consider a muddy water, and you have a stream and it's just rushing, and then the whole thing gets muddy and you can't see the bottom. But when you calm, and just let things be, let it settle, then you can clearly see what's going on. And I think that's the meditations really got me through it all.
Yeah, gotcha. Awesome. Well, thank you for sharing all this. I mean, great stuff going through and just trying to the mental aspect of dentistry, I think is becoming more evident. But when you're in your day to day and you're busy and you're doing everything, it's hard, right? Like you said, for your brother, he barely took any time off when he was going through that because he had to get right back to it. What does your day to day look like now? What are you up to? Are you still practicing dentistry? What's your future look like? Where are you going?
So yes, I'm in private practice, and I work evenings and some weekends, but I do take a day off in the middle of the week, to be on podcasts like yours. But my other, one of the things that I felt lacking, with Manu's progress, and I get it, he was in Canada, it's a different type of practice of medicine. Um, and I really feel that definitely COVID played a role in it, but I feel like his care wasn't adequate in Canada. There were a lot of missed opportunities, from a late diagnosis, to the way the treatment was done. And I couldn't do a lot to save Manu. There was a sense of guilt attached to it. Couldn't save him as a dentist, as an older sister. It's kind of your responsibility to take care of your kid brother. We were almost 8 years apart. I mean, I've cleaned his diapers. And and then to set him free. There's a lot that the mind, that the body does. It's an autopilot, and then the mind processes kind of later on. So when all, was done, I helped, first of all, finish these blogs that he was writing into the book, Life Interrupted, Doctor Do a Survival Guide. Um, that was something he had wanted, he had expressed. And because I couldn't do anything else for him, I was like, okay, I'm going to make this vision for him happen. And I completed writing the ending, just kind of going through the treatment and who he was and why he, what happened. Um, so that he would have more of a voice. And so I finished that book and I started the Do a Good Job Symposium, which is um, I wanted to have a three-dimensional view of cancer, like not only like, yeah, you know what to do, you know what the risk factors are as dentists. We know we have to send up for a biopsy. Who do we refer to? But advocating for really paying more attention to these, push for the earlier diagnosis, what happens afterwards, the oral systemic links, how you need to prep the patient before their cancer treatment, fluoride trays, radiation trays, nutrition aspects, limited opening when they're done. There's so much to cancer, the emotional aspects of it, and even like stuff like estate planning. I mean, 30-year-olds are not thinking about estate planning. But if you have your own practice, you have children, that might be something you want to look at. And you don't have to have cancer to, make you do that. These are things you want to look at kind of beforehand. And then some inspirational message. So that's what the Do a Good Job Symposium was like. Don't let cancer, be the end all be all. It can motivate you to do something better. So that's one aspect of it. I speak on educating, and I'm speaking at the 88 this year, which I'm very privileged. And I was very lucky to actually present in Oklahoma this year too, and which is, OU is my alma mater. So that was very, very endearing to me. And and then and I have had a lot of people come up to me, either sharing their own stories, their own challenges with cancer, or losing a loved one, sibling loss, which is kind of unique loss. And that's helped me channel my grief because it helps sharing, and also help others along the way because I've traveled that path. So um, being a healthcare provider where you're constantly serving others, and you're putting their needs above yours, um, can drain you sometimes. And then throw in a life challenge, that really alters. So yeah, so I help others process grief.
There you go. And you say that like it's, just I help others process grief, right? Amazing. And people need more of that, obviously, and especially now. And I think a lot of times it's something that doesn't even come out, right? People hide it, they keep it down. I remember, listening to you and seeing you at the dental festival speaking, there was some other stories kind of similar to yours, and in the sense that, trying to get this out in the forefront. I mean, if people are in need of this, how do they reach out to you? And when they do, what does that look like along the path of discovering this, I guess, and helping them along that way?
Sure. I'm on Instagram at DUA Good Job. Um, it's a pun off my maiden name.
Yeah.
And of course the DUA Good Job Symposium, it's doagoodjob.com. There's a grief coaching site there. They can reach out to me and see if I can be of any help. But yeah, I've always been an open book to this journey because it doesn't have to be done alone. And I think when a lot of times with processing something, like that, and it could be loss of not necessarily so any loss, people want to be validated. They want to be seen and heard. And so I'm always there to answer a message, give you a hug, or encourage you that, yeah, it can be very challenging, but life does go on, and there's a beauty in that. And you just learn to cope with it.
Yeah. Yeah. All right. So obviously, guys, reach out to her if you have anything going on through there. She's amazing just to talk to you here today. So, Parul, I want to kind of take this, and obviously we're doing great things there. I want to kind of get into the business aspect. I mean, how has this changed your business? What does that look like now? You're still practicing, you're still doing all of this. what have you taken from that? And have you changed how you practice or how you approach the business side of things?
Yes. I mean, this was a conscious decision I had made even prior to Manu being even diagnosed, was getting off the Medicaid insurances, because I felt like I needed to provide the dentistry I needed to do without feeling not well compensated for it, if that makes sense, because it is a business after all. And so, definitely, my new patient appointments are good, hour and a half long sometimes. And I'm like, okay, what's going on? What brings you here? And, like yesterday, I had a patient who broke a tooth, and she put a temporary filling herself, and she wouldn't let me take out the temp without numbing her. And she was so freaked out about just being in the chair, and she was crying. And I'm like, what's going on? I'm like, this is not it. So, and it's that I think this has changed me to be a more empathetic provider. And then, she came out and told me her personal stuff. And it's amazing how much people will reveal to yourself, and think we become therapists. So with my business, it's keeping in mind the business aspect of it, but really being a patient-centric dental office where we put our patients' needs first. And I think that's created a lot of internal referrals for me, because people feel that they can share and they're heard, and then they're given the time, when they're in their chair with me, that they don't feel rushed. That, okay, we're here, we're for you. What's going on? What can I help you with? And if I can't, I'll refer you out. Um, so that's how it's changed my practice to being more empathetic and being more present to what I'm doing, for the person, that it goes beyond just a tooth. I think there's been a loss of that somewhere along in medicine. Um, and I'm just trying to bring it back. And then after our calls, we don't have a recording. We have my front desk pick up the calls. She filters them.
Mhm.
So if there is a dire need, I will go into the office and take care of the patient, because there's nothing like a toothache. And, when they go to urgent care, they're not doing anything. They can't. They physically can't do anything. So, I think just having that comfort that your dentist is available should you need them. So these are like more things that I've changed to be a more patient-centric practice.
Nice. Yeah, do the right thing for the patient, and the rest takes care of itself, as they say, right? So,
Yeah.
word gets around. I think something that probably a lot of dentists struggle with, I can remember early on when I was a dentist, one of the things that was tough is we get all this training, right? We go through and we understand how to identify normal and what's not normal. Speaking about early diagnosis early on, it's a big thing. But as a dentist and a provider, I think you get the two extremes. You got the dentist that goes in and says, every little thing I see that might be kind of abnormal, referring out, or biopsy or something like that, right? Which can be to an extreme, maybe not a bad thing. But then you have the other side, we're saying, you know, I don't know if it's anything. Should I send that patient off for a referral? I don't want them to, get upset or have to go pay for something and it end up being nothing. What advice do you give to those dentists on either side of that? And, how do you go about that kind of early diagnosis piece in your own practice?
First of all, look around to see if there's a contributing factor. I've had cases where I had this young 17-year-old, and you see this leukoplakia right on the floor of the mouth, which is one of the, uh, you know, common sites for oral cancer. And then I'm talking to him. I'm like, what's going on? Why do you have this? Do you vape? Vaping is a big thing in young adults now. And he's like, no, I got a new retainer. I left it at home, but I think it rubs against my tongue. And he brought it in, we checked it out, adjusted it, saw, and then evaluate and bring them back in 2 weeks. And you're like, okay, it's gone. But it was so typical looking. And then there was one guy, same thing on the back of, near the wisdom tooth. There was he's like, I can't swallow. That's one of the signs of oral cancer, an inability to swallow. And sure enough, there was this huge white patch. But he had a broken tooth. We adjusted it, gave him a Stella Life rinse, brought him back in 2 weeks. And I think that's the essential, finding out what's going on with your patient, what's changed in their lives, new appliance, new treatment, new something. And adjust that and follow up in 2 weeks. And that's really crucial to it. Just come back, let me take a look, or send me a picture for me. We have technology,
Yeah.
right? Use it to your advantage. Take pictures, show it to your patient. Like, this is what concerns me. I want you to see you in 2 weeks and we'll see it. Or send me a picture from your home and, you can put it in their chart. We all have pretty much digital charts at this point. So we can use that technology to our advantage. So that's one thing. You see something, yeah, it may seem like an overkill. I would say 80% of the leukoplegia are, nothing, but there is that 20% chance, right? And oral cancer is the sixth most common cancer right now. So it's more and more prevalent. And there's no other test besides us feeling, looking, asking, and being more mindful of what we're looking for. One of the suggestions I would say is, like, if you see something suspicious and you're worried about sending them to the oral surgeon, is do it yourself. Because yes, people will push the biopsy. They'll be like, no, I have my kid's birthday. We're going on vacation. I'll do it after. And the after becomes maybe never. And then it's become a bigger deal, right? So if you're doing surgical extractions, you're placing implants, you can do a simple biopsy on a tongue or a cheek, maybe not the soft palate. You can do the hard palate. You can do gingiva.
Yeah.
Get the training, and your patients trust you. They see you more often. They don't want to go to a new dentist or new oral surgeon with that scary word biopsy on their heads. So learn to, and I started doing my own biopsies, fibromas, little stuff. I'm like, yeah, let's get it out. We'll get it labs. There's so many labs out there. They'll give you the samples and stuff, the little vial with all the equipment. They'll give it to you for free, and then you ship it to them. There's no charge. Um, so do that service for your patients. Get them biopsied earlier. So that's my suggestion, that if you're doing surgery and you're comfortable with that, do it in your in-house. It's a revenue stream, plus it's comfortable and you get the earlier diagnosis, and then just keep following up on it.
Mhm.
Um, yeah, it may seem like an overkill, but there'll also be that one time that you missed it. And that's the second most reason that dentists are getting sued these days, is failure to diagnose oral cancer.
Yes.
So just like you want to do your perio charting, and you want to get all those probing depths and you want to do those scaling and keep them on maintenance, it's the same
Mhm.
thing. I get there's no like big revenue on it, but
Right.
again, it goes back to serving your patients. And that's the ultimate,
Yeah.
reason sometimes we go here, besides the money again.
Yeah.
But
Yeah.
you're there to serve the population, and retaining that trust, that we're not always, after the money, that
Yeah.
we are them.
Yeah, for sure. I mean, and then we all took that oth, right, early on of, do
Yeah.
what's right for the patient, and like we said, you do what's right, the rest will follow. Kind of goes through there. So I love that. I mean, a really good aspect to it, having those hard conversations as dentists, as professionals, as people that care for our patients. We have to have those sometimes, and sometimes we're wrong, and it's as long as it's coming from a good place, right? You're trying to do what's right for the patient. I don't think you're going to run into those patients that are like, you sent me and nothing happened, and it might happen, but at least at night you can sleep easy. Like, hey, well, good thing, right? We know what it is now, or
Right.
we know what it's not. Um,
Right.
something
And
that yeah,
no, I was just going to say, I was just going to add to that. It comes with education, right? Like, there wasn't such a big push for airway. Now there is, because we know, and more into ortho, like expansions,
Mhm.
and that's the thing. Like, it's what we didn't know. Now that we know it, you can't ignore it. You just kind of have to step up to the plate a little bit.
Yeah, continuing education, right? You're speaking at the ADA. I'm off to a different CE. It's one of those things where, yeah, get out there and learn more. The more you learn, if you learn how to do the biopsies, just like if you learn how to do root canals, you get better at diagnosing root canals, right? You send more to your specialist because you see it more often. I think if you're doing more biopsies, obviously you learn another aspect and you get a little more confident in that. So that's a kind of a unique thing. I don't do it in my practice, but after talking with you, I'm like, I might have to start doing that. Just again, take it to that next step, right? Um,
Yeah.
Rule, awesome, awesome. Well, we've been going here for a little while. I kind of want to end on just kind of a quick little note here. We call it the 3X level up. I want to kind of go through some just little tips and tricks and get some things about from you that people can apply really, really quickly here into their life, their business, mental health, and all this kind of stuff. So the first thing we do with the 3X level up is called a tip or a tool, right? What's a tip or a tool you couldn't live without? Anything that you feel helps you be more successful in your life or business, or help you to treat patients.
My intraoral camera. There's so many times that I see something and I'm like, you know what? Let me whip that thing out. Let me take a picture. Let me show you what I'm looking at. And I think it dissolves that mistrust that, oh, you just want to replace all my fillings, I'm like, no, there's a fracture. This is what's going on. Your old amalgam's broken down. This is a lesion. I see whatever it is, right? Like I am able to show them, and then the patients have more they're like, yes, we're on the same page now. Yes, I want to take care of this. Yeah. Or I'll be like, remember what I showed you? They're like, yes, I remember.
Yeah,
So
gotta love
yeah,
that
so
one.
that's what.
A picture's worth 1,000 words. I mean, in so many aspects. Perfect. Past
Yeah.
failures in our 3X level up. We all make a ton of mistakes. Just ask me. I've got plenty of them. What's a past mistake that you learned from?
I think not doing my endos properly. I mean, I struggled with that a little bit. And it was, but I do enjoy doing them. So I leveled up. I got the C's, and now I do all my endos, or still refer at my retreats. But I've had some that were failed, and or not realizing my own. I think that comes with practice too. Even for your new dentists that are listening, like don't be so hard on yourself. This is the practice of dentistry. We are going to make mistakes. Own up to them. Where I've had, oh my gosh, I remember this case. I was an associate then, and I separated a file. It was not my office, right? So I wasn't so my instrumentation. Like I was like, oh my gosh, I separated, and then I went to bypass it, and I separated that. I was like, oh my god, this is a disaster at this point. Now you off you go to endo, but and so instead of giving up on it, I got courses and training, and now, I never say I can do a root canal in an hour. No, it'll take me still an hour and a half. And I do rotary. But yeah, just getting the courses, getting the right training. If you enjoy doing that, and I do, so I learned it. And things that I don't enjoy, I don't.
There you
So
go. Guys,
yeah.
root canals. I know they will make your heart flutter a little bit and go through there. That's
Oh
for
yeah.
sure.
Yeah, for
Awesome.
sure.
There we go. Our next 3X level up advice for your younger self. What advice would you give your younger self knowing what you do today?
Uh, One, have your own practice a little bit earlier. Uh, and number two, my gosh, there are some hard challenges along the way, and things that'll bring you down to your knees. But take a deep breath and keep going. And three, like save for retirement early.
Nice. I love it. Very succinct and all encompassing. So, Pearl, I appreciate your time here today. I want to kind of wrap this up. I want to give you a kind of last word to tell us a little bit more, anything you want to say, where we can find you, and also if you guys haven't heard her speak, I had the privilege down in Key West. So, tell me a little bit about where we can see you and what are you up to next?
Sure. So you can find me at duagoodjob.com. Um, Email me, contact me, find me on Instagram, and join the Do a Good Job Symposium. You do get CEs, and it's a great insight to the world of oral cancer from like 20 speakers. Some are Nifty Thrifty people. And so it's a great insight to the world of cancer, and you earn seeds from your home. So that's a great resource. And you'll get the copy of the book, Life Interrupted, on there. Not that I don't think you can see it because of my
Oh yeah.
background, but yeah, I get a signed copy of the book. And yeah, I'll be speaking at the ADA. I'll be speaking in San Francisco in next January. So, but if you guys want me to come speak at your event, I'm happy to do so to share the knowledge and bring this awareness.
Awesome. I mean, powerful story, powerful background, turned into something great, right? Helping out dentists. So thank you so much for being here. Anything we do to support you along the way, we're here for you. Nifty Thrifty, here we are, right? We're talking to the people that we see every day in these groups. So putting a face behind it, putting a story behind it. We're meeting a lot of amazing people here on the podcast. So make sure you reach out, especially if you're struggling with anything or looking to support or help. Parul is a fantastic resource. So Nifty Thrifty, thank you. We'll see you guys next time. Bye.
Thank you.